As you may know, the Big Beautiful Bill was passed and signed into law on July 4th. What does this mean for our healthcare system? First, I want to say this is not about politics. I read facts as well as opinions from both sides. From an initial examination, and a lot of things can change before implementation, here's what I think we need to look out for. First, it is widely believed that people will lose coverage. Medicaid will be harder to get and more complicated to keep. Regardless of whether you feel that is needed and necessary or not, the bottom line is people who have coverage now will lose coverage. Even if you don't have Medicaid or even know anybody who does, this will affect your health care. I'll get into that in a second. Second, there are no direct benefit cuts to Medicare, which is good, but there are some spending reductions that could impact provider payments, support programs, and enforcement mechanisms. Again, I'm not debating whether you think these cuts are needed or not. I'm examining how it could affect our health care. While it won't affect the number of people with coverage, it could affect premiums and benefits, especially those with Medicare Advantage plans. Third, changes in Marketplace or ACA plans will likely cause premiums to surge, and many will lose coverage because they cannot or will not pay the premiums. Again, people who have coverage now will not have coverage. Debate the merits and reasons elsewhere, but the bottom line is prices are likely going up, credits are going down, and that means less people will have coverage. Even if you have a Cadillac of a health plan and money in the bank, these changes are going to affect the health care you receive, and it's important for all of us to understand what could happen. When people don't have health insurance, they delay care and they go to emergency rooms, oftentimes sicker than needed. If people do not have insurance, they also use ERs for non-emergent and chronic issues. If fewer people have insurance coverage, ER utilization will go up. That is a fact backed by research. Well, what does this mean for you? You could have longer than expected wait times, and if you've been to the ER recently, you know that's already an issue. Inadequate staffing and staff burnout could also have a real impact on the level of care you receive. ERs are required to treat patients regardless of their ability to pay, so hospitals will see more patients and an increase in unpaid care. Hospitals will be looking for ways to cut costs, and that could mean cutting staff or services, delaying facility improvements and equipment upgrades, and in some areas, hospitals may even shut down. ER utilization will go up, and hospitals will be faced with more uncompensated care, which means what you pay either through your insurance premiums or cash will likely go up as a result. Again, I'm not debating whether these changes need to be made, but